Have you started burping after almost every meal? Maybe it happens after only a few bites. Perhaps it continues for hours. Or maybe you wake up in the morning and begin burping before you have eaten anything. Most people assume this means they ate the wrong food. But here is something surprising. In some cases, the air causing repeated burping never reaches the stomach at all. It may be pulled into the esophagus and released again within seconds. That means antacids, probiotics, and complicated elimination diets may not solve the problem because you may be treating the wrong cause. And after age 60, several commonly overlooked factors can contribute. Eating habits, loose dentures, acid reflux, diabetes, and even certain medicines. Most burping is harmless, but a sudden change, especially when accompanied by trouble swallowing, vomiting, weight loss, black stool, or chest discomfort, should never be dismissed as just gas. In this video, we will uncover 7 common causes of repeated burping, beginning with the simple habits you may be doing without noticing. Cause number 6 involves medicines that millions of older adults take. And cause number 7 is one of the most frequently misunderstood reasons for constant burping. It does not necessarily begin in your stomach, and simply avoiding food may not stop it. Watch until the end, because I'll also give you a simple 7-day test that can help you identify your personal trigger. Before we begin, tell us in the comments. How old are you? Where are you watching from? And does your burping happen mainly during meals, after meals, or throughout the entire day? Your answer may help another person realize they are not alone. What actually happens when you burp? Let us first understand what a burp actually is. Whenever you swallow food, water, or even saliva, you usually swallow a small amount of air. That air can collect in the upper part of your stomach. As the stomach stretches, a muscular valve at the bottom of the esophagus briefly relaxes. The trapped air moves upward and escapes through your mouth. That is a normal gastric belch. Burping during or shortly after a meal is not automatically a sign of disease. In fact, healthy people may burp several times during the day. The important questions are not simply, how many times did I burp? The more useful questions are, has the pattern suddenly changed? Is it happening in repetitive bursts? Does it come with burning, nausea, pain, or early fullness? Is food or liquid becoming difficult to swallow? And is the symptom interfering with your ability to eat, sleep, or enjoy daily activities? Those details tell us much more than the number alone. Now, let us examine the 7 most common explanations. Cause number 1. You are swallowing more air than you realize. The first cause is called excessive air swallowing. And you do not need to feel yourself swallowing the air for it to happen. Consider how you eat. Do you eat quickly because the food is getting cold? Do you speak while chewing? Do you drink through a straw? Do you suck hard candies to manage a dry mouth? Do you chew gum throughout the day? Do you smoke? Each of these habits can increase the amount of air entering your digestive tract. One especially important factor for older adults is poorly fitting dentures. When dentures become loose, chewing and swallowing may change. You may open your mouth more frequently, chew less efficiently, and swallow additional air with the food. Here is a simple experiment. During your next meal, sit upright and put down your fork between bites. Chew slowly. Finish swallowing before speaking. Drink from an open cup instead of a straw. Then notice whether the burping becomes less intense. If it improves, the cause may not be the food itself. It may be how the food and air are entering your body together. If you wear dentures and they move while you chew, mention that to your dentist. A small adjustment can sometimes make eating far more comfortable. But if slowing down does not help, the second cause may be hiding inside something you drink every day. Cause number 2. Carbonated drinks, in light, healthy ones. Soda is an obvious source of gas, but it is not the only one. Sparkling water, tonic water, beer, kombucha, and fizzy vitamin drinks also contain carbon dioxide. When you swallow these bubbles, they enter your stomach. Your body then needs to release some of that gas. That release often happens through burping. Many people replace sugary soda with sparkling water, believing it cannot contribute because it contains no sugar. It may be a better choice for sugar intake, but it is still carbonated. Try replacing every carbonated drink with still water for 7 days.
Do not change 10 things at the same time. Change only the carbonation first. If your burping decreases noticeably, you have found a major clue. And be careful with straws. Even when the drink is not carbonated, using a straw may encourage some people to swallow additional air. If this information is already helping you understand your symptoms, subscribe to the channel. Every week, we explain common health concerns in clear language designed especially for adults over 60. Now we move to a cause that can produce burping even when you have not consumed a fizzy drink. Cause number 3, acid reflux or GERD. At the lower end of your esophagus is a muscular valve. Its job is to allow food to enter the stomach and then help prevent stomach contents from moving backward. When this valve becomes weak or relaxes when it should remain closed, stomach contents may travel upward. This is acid reflux. When the problem becomes frequent or produces ongoing symptoms or complications, it may be diagnosed as gastroesophageal reflux disease, or GERD. Burping alone does not prove you have GERD, but reflux becomes more likely when burping appears with other symptoms, including a burning sensation behind the breastbone, a sour or bitter taste in the mouth, food or liquid coming back into the throat, a chronic cough, hoarseness, nausea, or symptoms that worsen when you lie down. Some people have reflux without the classic burning feeling. They may notice throat clearing, coughing, regurgitation, or an unpleasant taste instead. A hiatal hernia can also contribute. This occurs when part of the stomach moves upward through an opening in the diaphragm. Certain medicines may worsen reflux as well, but we will discuss those separately in cause number 6. If your symptoms are worse at night, avoid eating during the 3 hours before lying down. Consider smaller meals instead of one enormous evening meal, and pay attention to your individual triggers. Common triggers may include alcohol, high-fat meals, chocolate, caffeine, mint, acidic foods, or spicy food, but not everyone reacts to the same items. Do not unnecessarily eliminate everything from your diet. Keep a written record and look for a repeated connection between a specific food and your symptoms. If frequent reflux continues despite reasonable changes, speak with your healthcare provider. Persistent reflux sometimes requires proper diagnosis and treatment. The next cause feels similar to reflux, but it is not exactly the same condition. Cause number 4, functional dyspepsia or chronic indigestion. Do you begin eating while feeling hungry, but after only a few bites, you suddenly feel uncomfortably full? Does the upper part of your abdomen feel heavy, tight, or swollen? Do you experience nausea, burning, or frequent burping, even though testing has not revealed a clear ulcer or blockage? This group of symptoms may be described as dyspepsia, commonly called indigestion. Indigestion is not one single disease. It is a collection of symptoms that can include upper abdominal discomfort, feeling full too quickly, remaining full long after eating, bloating, nausea, and belching. In many people, doctors cannot identify a structural disease causing chronic indigestion. This is often called functional dyspepsia. The word functional does not mean the symptoms are imaginary. It means the digestive organs may look normal, but the way the stomach, nerves, and brain process movement and sensation is not functioning comfortably. Large meals may make the symptoms more noticeable.
Eating slowly and choosing smaller portions may help some people, but persistent symptoms should be discussed with a healthcare professional, especially if they begin suddenly later in life. And if burping occurs with nausea, vomiting, and food sitting heavily for several hours, the next cause becomes particularly important. Cause number 5. Delayed stomach emptying. Your stomach does more than hold food. Its muscles grind the meal and gradually move it into the small intestine. If this movement becomes unusually slow, food can remain in the stomach longer than expected. This condition is called gastroparesis, or delayed gastric emptying. Symptoms can include feeling full soon after beginning a meal, remaining full for a long time afterward, nausea, vomiting, upper abdominal discomfort, bloating, heartburn, and excessive burping. Diabetes is the most common known cause of gastroparesis. Over time, high blood sugar can damage nerves involved in stomach movement. However, experiencing burping does not mean you automatically have gastroparesis. Doctors normally consider the complete pattern. Burping combined with significant early fullness, nausea, vomiting, or difficulty controlling blood sugar deserves more attention than burping by itself. Do not diagnose gastroparesis from a YouTube video or begin an extremely restrictive diet without medical guidance. A healthcare provider may review your symptoms, diabetes history, and medications. If appropriate, they can arrange tests that measure how quickly food leaves your stomach. This brings us to the cause many seniors overlook because it may be sitting inside their medicine cabinet. Cause number 6. Your medications. Several medicines can affect the digestive system. Some may relax the valve between the stomach and esophagus, making reflux symptoms more likely. Others can slow stomach emptying or contribute to nausea, fullness, and constipation. Examples can include certain opioid pain medicines, some antidepressants, some medicines with anticholinergic effects, and certain calcium channel blockers used for blood pressure. This does not mean your medication is dangerous or that you should stop taking it. Stopping a prescribed medicine suddenly can be far more dangerous than the digestive symptom you are trying to solve. Instead, ask a better question. Could any of my medicines or supplements be contributing to this new burping, reflux, or fullness? Write down everything you take, including prescription medicines, over-the-counter pain relievers, vitamins, and herbal supplements. Note when each item is taken and whether your symptoms began after a new medicine was added or its dose was increased. Take that list to your doctor or pharmacist. Sometimes the solution involves adjusting the timing, changing the dose, or considering an alternative. But those decisions must be made with the professional managing your treatment. If you know someone who takes several medicines and constantly complains about indigestion, share this video with them. It may give them the right question to ask at their next appointment. Now we reach cause number 7, the one that surprises most people. Cause number 7, the air may not be coming from your stomach. Not every burp is created in the stomach. Doctors recognize another pattern called supragastric belching. In this pattern, air is quickly drawn into the esophagus and immediately expelled. The air may never travel down into the stomach. The process can happen rapidly and repeatedly, sometimes many times within a short period. People are usually not doing this deliberately. It can become a learned physical pattern connected to discomfort, stress, anticipation, or increased awareness of the throat and chest. The symptoms are real. But because the mechanism is different, treatments aimed only at stomach acid or food may not solve the problem. A clue can be frequent. Repetitive burping that occurs in bursts and changes depending on attention, conversation, stress, or activity. However, you cannot reliably diagnose the type of belching yourself. Specialists may use history, examination, and tests such as impedance monitoring to distinguish gastric from supragastric belching. Here is the encouraging part. Because this pattern involves coordination between breathing, the esophagus, and the nervous system, behavioral treatments can help. The American Gastroenterological Association lists approaches such as diaphragmatic breathing, speech therapy, cognitive behavioral therapy, and other brain-gut behavioral treatments. Try this gentle breathing exercise. Sit upright and relax your shoulders. Place one hand on your upper chest and the other over your abdomen. Breathe in slowly through your nose, allowing the lower hand to rise while keeping the upper chest relatively quiet. Then breathe out slowly through pursed lips. Do this comfortably for 3 to 5 minutes. Do not force a deep breath or continue if you become dizzy. Practicing before and after meals may help reduce tension and interrupt repeated air movement for some people. This is not proof that stress caused your symptoms. It simply means that breathing, nerves, muscles, and digestion continuously communicate with one another. The 7-day burping test. Now let us put everything together. For 7 days, keep a simple record. You do not need a special app. A sheet of paper is enough. Write down 4 things. Number 1, when does the burping happen? Before eating, during eating, immediately afterward, several hours later, or when lying down. Number 2, what did you eat and drink? Pay special attention to carbonated beverages, gum, hard candies, and large evening meals. Number 3, what other symptoms appeared? Burning, bitter taste, nausea, early fullness, abdominal pain, constipation, diarrhea, or difficulty swallowing. Number 4, what medicines or supplements did you take near that time? During the same 7 days, avoid carbonated drinks. Avoid chewing gum and hard candies. Drink without a straw. Eat while sitting down. Chew slowly. Finish swallowing before speaking. Avoid lying down for 3 hours after your evening meal if reflux is part of the pattern. And practice gentle diaphragmatic breathing once or twice daily. Do not stop prescribed medication, and do not remove entire food groups unless a qualified professional advises you to do so. At the end of the week, review your notes. If the burping clearly improves, reintroduce only one suspected trigger at a time. That may help you identify what matters without creating a needlessly restrictive diet. If the problem does not improve, take your record to your healthcare provider. A clear symptom history can make the medical conversation much more productive. Warning signs when burping needs medical attention. Most burping is a minor digestive symptom, but context changes everything. Contact a healthcare professional. If the burping is persistent, suddenly worsens or occurs with unexplained weight loss, loss of appetite, frequent vomiting, fever, persistent or severe abdominal pain, new constipation or diarrhea, difficulty swallowing, pain while swallowing, food repeatedly feeling stuck, vomiting blood or material resembling coffee grounds, blood in the stool or black tarry stool. And please remember this important warning. Do not automatically call chest discomfort gas. If you experience new or severe chest pressure, shortness of breath, sweating, dizziness, weakness, nausea, or pain spreading into the arm, shoulder, neck, or jaw, seek emergency medical help. Burping may happen at the same time as a heart problem, but the burping itself cannot safely explain away those warning symptoms. It is always better to be checked and discover that the cause is harmless than to ignore a medical emergency. Final recap in CTA, let us quickly review the 7 causes. Number 1, swallowing excess air. Number 2, carbonated drinks. Number 3, acid reflux or GERD. Number 4, functional dyspepsia or chronic indigestion. Number 5, delayed stomach emptying. Number 6, medications. And number 7, supragastric belching, in which the air may be entering and leaving the esophagus without reaching the stomach. The biggest lesson is this: do not focus only on what you ate. Pay attention to how you eat, what you drink when the burping appears, which medicines you take, and what other symptoms occur with it. Now tell us in the comments, which of these 7 causes surprised you most? If this video helped you, press the like button, share it with another senior, and subscribe for more clear, practical health information designed for life after 60. This video is for general education and is not a diagnosis or a replacement for medical care. Always speak with a qualified healthcare professional about persistent or concerning symptoms. Thank you for watching and take good care of yourself.